The seventh week of the 2018 Kentucky General Assembly saw the introduction of several new bills related to health care, and swift action has been requested on one KMA priority bill in particular, Senate Bill 2. While legislators won't gavel back in until Tuesday afternoon due to the President's Day holiday, members are being asked to contact their senators in support of this important legislation. Senate Bill 2, sponsored by Senator Ralph Alvarado, proposes an amendment to Section 54 of the Kentucky Constitution that would allow the General Assembly to establish reasonable thresholds for jury awards. The bill passed favorably from the Senate State and Local Government Committee on February 7th, and a full Senate floor vote is expected early this week. So KMA is asking members to contact their senators immediately in support of this bill, which would greatly improve the legal liability climate in the state and is a top legislative priority for KMA. Unfortunately, though the issue has broad support from the business and healthcare community, opponents are making quite a bit of noise. Please reach out to your senator today and ask them to vote yes on Senate Bill 2 and allow the voters to decide the type of legal liability climate they want for Kentucky. Another KMA priority bill, Senate Bill 143, was introduced last week. Also sponsored by Senator Alvarado, Senate Bill 143 would enhance access to prior authorization information, establish one-year approvals for chronic disease medications, prevent retroactive denial, enhance the review process, standardize review times, and increase access to electronic prior authorizations. This bill would remove several roadblocks for patients trying to access medications and treatment and allow providers to make decisions regarding care instead of insurance companies. Senate Bill 143 has been referred to the Senate Banking and Insurance Committee. KMA is committed to identifying administrative hurdles that inhibit care and will continue to advocate for legislation that effectively removes them. As a result, KMA is pleased to support Senate Bill 143. Finally, another administrative simplification bill passed favorably from the House Banking and Insurance Committee last week by unanimous vote. House Bill 69, sponsored by Representative Ken Fleming, would require the Department of Medicaid Services to designate a single credentialing verification organization to verify credentials for DMS and all Medicaid managed care organizations. The measure would also streamline provider enrollment and credentialing procedures, as well as written internal appeals process utilized by MCOs. House Bill 69 now moves to the full House for consideration. Please call your senator and representative and ask them to support Senate Bill 143 and House Bill 69 in order to remove administrative barriers to patient care.